Hey everyone, this is Victor here from Cyborg for Life. Today I have a very special interview for you. He is a world-renowned orthopedic surgeon and chief and founder of the Limb Lengthening and Complex Reconstruction Service at Hospital for Special Surgery. Please enjoy the interview with Dr. Robert Rozbruch. All right everyone, today we have a very special guest joining us. He is the chief of the Limb Lengthening and Complex Reconstruction Service at the Hospital for Special Surgery, #1 in orthopedics for the 10th consecutive year by US News and World Report. Not only can he make you taller, but he also solves complicated conditions that perplex most doctors and even other orthopedic surgeons, which is why patients from around the world choose him to fix their problems so they can get back to a normal life. He is known as the saver of limbs. Please join me in welcoming world-renowned orthopedic surgeon, Dr. Robert Rozbruch. Hey, Dr. Rozbruch, how are you doing today?
I'm well, thank you, Victor. Thank you for having me on your program.
Well, thank you for joining me. It's great to hear. So your qualifications and contributions to the limb lengthening industry are really incredible. Graduating from Weill Cornell Med School with honors in research, you did your residency at the Hospital for Special Surgery, as well as fellowships at the University of Bern and the International Center for Limb Lengthening. You are the chief and founder of the Limb Lengthening and Complex Reconstruction Service at the HSS, and even a professor of orthopedic surgery at Cornell. You've also written over 150 articles in medical journals, as well as 2 major books on limb lengthening and deformity reconstruction. I guess there's no wonder why you're associated with terms like best in the world and, mentor to other great limb lengthening surgeons. So to start us off, I got to know, why did you decide to take up the subspecialty of limb lengthening over general orthopedic surgery?
Well, first, Victor, thank you for all those really nice things that you said about me.
True.
You're making me blush, and I appreciate it. Well, I love what I do. And I hope that comes across in the way I interact with patients and how I approach each day. I love orthopedic surgery. I decided I wanted to be a surgeon since I was a little kid watching MASH on TV. I fell in love with Hawkeye, and somewhere along the way, I decided that orthopedic surgery was my passion. Mm-hmm. And so as far back as I can remember, I knew I wanted to be a surgeon. I love fixing things, and I love helping people. Mm-hmm. So that's what led me into surgery.
That's awesome.
I trained to be an orthopedic surgeon. I became interested in fixing bones and gravitated toward the subspecialty of orthopedic trauma. Mm-hmm. And that's what I really did at first. My first fellowship was in ortho trauma. Okay. And I practiced fracture surgery from 1996 through 1999. Wow. And so that's how I came into this as a trauma orthopedic surgeon. Okay. And my story, everybody has a story. My story is that as I did more and more trauma work, and we realized that some of the most complicated cases involved infections after trauma, or missing bone, or deformities after trauma. And so the post-traumatic reconstruction problems were really quite challenging. And I was intrigued by the Iliotibial method, and what that could offer to my patients. Things like bone transport, limb salvage, deformity correction. And that's what really encouraged me to seek out additional training back in 1999. And I trained with Dr. Paley and Dr. Herzenberg at that time. And this really launched and opened my eyes to a whole new world that was incredibly exciting. And as I got more and more into it, you just sort of go with the flow. Right. And there's an entire, this entire new skill set that I had that was different than what most orthopedic surgeons had. And it wasn't a day in the beginning where I would hear people say, and what I mean by people, I mean patients and other orthopedic surgeons, say, wow, I didn't know you could do that, and just hearing that on a daily basis, I realized that we really had something very unique and very special. And that's been the story of my career over the last 20 years, is taking on, tough situations, challenging situations, collaborating with other surgeons. Mm-hmm. We often take on cases that other surgeons ask us to take over because they are complicated and difficult. We take on patients who were told by other doctors, there's nothing you can do for this. You got to live with it. Mm-hmm. And so that's been my career, and it's exhilarating for me, professionally and intellectually, and it's exhilarating to be able to provide this special service to people, and I really feel like we change people's lives.
Absolutely. Absolutely. So that is a really unique transition from the traditional to the extraordinary. So to further elaborate, what exactly is the scope of limb lengthening, and where does stature lengthening for, helping people get taller, where does that find a place in your practice?
Yeah, I'm glad you asked that. Stature lengthening is a very exciting topic, and I can't go to a cocktail party without being approached by a half a dozen peers, and everybody says, well, can you make me taller, can you make me taller? And so it's clearly the thing that in common conversation comes up quite a bit.
Right.
I want to make sure in an interview like this, and we're going to speak in this interview mostly about stature lengthening, and I respect that, and we're going to dive deeper in that.
Right.
But it is important to understand where this fits in the scope of a limb lengthening complex reconstruction practice.
Right.
We take on, stature lengthening is a part of what I do, and but a big part of what we do is reconstructive surgery, deformity correction, limb salvage work. And it's really, a lot of it is based on sort of the original principles of the Iliotibial method.
Okay.
So this exciting realization that you can grow new bone, right? By cutting a bone, bone has the ability to regenerate new bone. And by gradually pulling the bone apart, distraction osteogenesis, which is a term that was coined by Iliotibial in the 1950s, about 70 years ago now.
Yeah.
You can grow new bone. You can elongate bone. And you can elongate bone. You can also change the position of bone. So for severe deformities, for shortening, you can actually elongate and straighten a leg. You can replace missing bone. You can do it in adults. You can do it in children. You can do it for people who have post-traumatic types of problems and for people who have congenital problems. So that's really the foundation of what this is all about, and that is limb lengthening. We often will call our specialty limb lengthening and reconstruction surgery.
Gotcha.
Because it does involve this entire process.
I see.
Now, stature lengthening is quite simply lengthening both legs at the same time. Most of the time for leg length discrepancies, we're doing it on one side only. But for lots of things in limb deformity, if somebody has severe bow leg deformities or severe knock-knee deformities that are associated with lots of different types of conditions, we are operating on both legs to straighten them out. Stature lengthening is bone lengthening on both legs at the same time.
Right.
And so that's how it fits into my practice. I mean, it is a part of my practice, and I love doing it. And I think for carefully selected patients who are serious about what this can offer them and how it can change their lives, we've had great outcomes, and I'm happy to talk to you more about that.
Okay, great. That is awesome, because as time goes on and on, I know that stature lengthening for getting taller is becoming more popular. I mean, kids who are growing up and they feel like their genetics betrayed them, when they become successful and they have a really strong mindset, this is an option that they can use to improve their quality of life. So I want to get your thoughts on some of the common concerns I hear from people who are considering stature lengthening. First of all, let's say that a patient wants to lengthen, their either their femurs or their tibiae. What's the average height or that you allow them to lengthen on the bones? Or is it more dependent on the person or how the distraction phase develops?
Yeah, so first, before I get into those details, I want to say patient selection is important.
Okay.
And I know you didn't specifically ask this, but I think it is important. And I want to just kind of say a couple of words about that before we get into the nitty gritty of the femur and the tibia.
Absolutely.
The patients that I think are really good candidates for this are people who have short stature. Now, there isn't an exact number. And I don't pretend to have an exact cutoff, but we're looking for people who have short stature, who are somebody who's 5'10", who's in the 90th percentile is not short stature.
Gotcha.
Right? It doesn't make sense. But the typical patient is a male patient who is 5'4",
Okay.
5'3", 5'4", 5'5".
Right.
5'4" is the 2.5th percentile for a male.
Mm-hmm.
What does that mean? What does a percentile mean? It means that 97.5% of men are taller than that individual. And that kind of reality is what creates a psychological problem for certain people. For some people, it's a non-issue. And if it's a non-issue, clearly nothing needs to be done.
Right.
But for some people, it really creates this feeling of psychological distress. And I have noticed from talking to many, many, many people over the years, these are intelligent people who are pretty well adjusted and pretty normal as anybody else is normal in all other aspects of their life. But the issue of their stature is something that really gnaws at them. They think about it all the time, whether they think about it daily or every other day or weekly. It impacts their self-confidence, their self-esteem. It impacts the way they're able to interact with the outside world. And if we can find people who really are pretty well adjusted in other ways, but for whom this is a very specific issue, and if those patients have realistic expectations of what can be accomplished and how this can change their life, those are the kind of patients that we've had really, really positive experience with, really positive success with their treatment.
I see.
Now, in terms of how much you can do, there are lots of different ways to do this, but I will say certain principles that I've learned. Femur lengthening using internal lengthening nails is an easier process than tibia lengthening.
Okay.
So it's easier to do it above the knee than it is below the knee.
Okay.
Why? For two reasons. One is the femur bone heals faster. It's just got more soft tissue. There's more muscle around it, so it heals faster.
Okay.
And number two, soft tissue contractures in the thigh are less problematic than they are in the leg.
Makes sense.
Okay.
Yeah.
So in the femur, we will shoot for 8 centimeters if we're doing a stature lengthening, and 8 centimeters is quite frankly just the maximum amount that the internal lengthening nail will allow us to go.
Gotcha.
So we'll go 8 centimeters. Now, for the time and effort that it takes to do about 8 centimeters in the femur, you can usually do about 5 to 6 centimeters in the tibia.
Okay.
So the tibia is just a more finicky bone. It doesn't grow bone as fast, so we tend to go slower.
Okay.
And the maximum amount that you can get before you sort of hit that wall of problems related to soft tissue contractures and other issues is lower. So my goal typically is 8 centimeters in the femur and about 5 to 6 centimeters in the tibia. Now, these are just guidelines. I mean, none of this is set in stone.
That I gotcha. Yeah. And like you said, it's not set in stone. It depends on the person and all kinds of factors, flexibility and all that. Amazing. Now, Dr. Rozbruch, you're involved in a lot of interesting research. Like, I was really impressed. One of the projects that really stood out to me was the importance of a gastrocnemius recession and tibial lengthening, like you just mentioned. Is this used as a preventative measure, or is it used for somebody who actually develops a muscle contracture, like an equinus contracture, like you just mentioned?
Sure, it's a great question. Yeah. So again, you're asking about tibia lengthening, and I would say in the world of stature lengthening, probably 3/4 of what I do is femur lengthening.
Okay.
And about 1/4 of what I do is tibia lengthening.
Okay, gotcha.
Because I'm usually steering people to do the femurs. Yeah. And most of the time we're doing the femurs, we get 8 centimeters, and we're done.
Okay.
Right? If somebody wants to come back and do the tibias as a secondary procedure, then we will do that. Okay. But for the most part, I am steering people to do the femurs rather than the tibias.
Gotcha.
In the femurs, the concept of doing soft tissue releases during lengthening is an interesting discussion. Yeah. And most of the soft tissues will stretch and grow. Right. It's a term called distraction histiogenesis, which means that the tissues will actually stretch and grow. But there are certain there are certain particular stubborn soft tissues. So in the femur, the iliotibial band is very stubborn.
Right.
And will get extremely, extremely tight and will really create havoc for the knee. And so we have learned from experience that just like we cut the bone and we grow the bone, we will cut the iliotibial band because it's really tight. And then as the thigh is lengthened, the iliotibial band, the ITB, will actually grow.
Wow.
So it's not like we're severing it, we're cutting it in order to let it grow and elongate with the bone.
Yeah.
The rest of the tissues, the rest of the muscles usually are able to be stretched on their own with an aggressive, regular physiotherapy program.
Gotcha.
Now in the leg, the stubborn soft tissue is the Gastro-Soleus complex. Basically, it's the muscle, it's the gastrocnemius muscle, the soleus muscle, and that consolidates and turns into the Achilles tendon. And so people left to their own devices will really develop a ballet foot. And so it's really important to stretch, to do dorsiflexion stretching to prevent that from happening.
Yeah. Definitely.
Now, the study that you're talking about, we were able to show that in lengthenings of the leg over 4 centimeters, most of the time patients ended up needing a Gastro-Soleus recession.
Okay.
And so we use that as a general guideline for when to do a Gastro-Soleus recession. It can either be done proactively at the same time as the lengthening, or it can be held as a let's wait and see if we need it type of thing. And I think, again, there isn't an absolute on that. It depends on the amount of lengthening that we're planning to do. It depends on the flexibility of the patient going into it, and it depends on their desire going into it. If somebody can maintain their mobility without the Gastro-Soleus recession, then it's not necessary. If they're unable to and they end up with an equinus contracture, clearly we need to do it. And then there are times that we will do it at the same time as the initial surgery prophylactically.
I see. Wow. Amazing. I love hearing about research that, is being done to advance the field. A true pioneer. Okay. So let's talk about proportions and stature lengthening. It's known that your limb proportions are going to change. Now, for someone who wants to undergo to get taller, what are your thoughts when they ask, do you ever hear of anybody asking, hey, doc, I want to, be balanced in proportion, or can I lengthen my arms too? Do you ever get that?
Yeah. So, a basic understanding of the dimensions of the body is essential. And everybody knows the Vitruvian Man from, from Leonardo da Vinci. And so generally our wingspan is equal to our height. Right. There are differences in proportionality between trunk length to limb length, between different people and between genders. And the tip and the proportionality within the lower extremities is usually pretty standard. And that is that the length of the leg bone is usually about 80% of the length of the thigh bone. So when we go into, we analyze patients, and one of the things that I always do is we get a long x-ray, both from hip to ankle. We look at their alignment, we look at their leg length. Sometimes we'll find that people come in, they're interested in stature lengthening, and they have a 1 centimeter or 1.5 centimeter leg length discrepancy.
Wow.
And then I will try them out with some blocks, and then they'll say, wow, that feels much more comfortable. Well, that's important information because I'm going to want to fix that when we do our stature lengthening. Similarly, sometimes people will come in and they will have a deformity. Sometimes they'll have a bow leg, or they'll have a knock knee, or they'll have a torsional deformity in their femur or their tibia. And so we try to go through a full analysis to make sure that we uncover any of these deformities, any discrepancies, any asymmetries, and fix them during the surgery, because it's an opportunity to actually take care of those things. Now, assuming that somebody comes in and they have normal proportion, any kind of lengthening of one bone, one set of bones, is going to create some degree of disproportion. Having said that, the femur is my first choice for lengthening for 2 reasons. One is, from an aesthetic point of view, the femur is not very visible. So like where the hip starts and ends, is not so clear because everybody wears their pants at different levels. Some people wear their shirts in, some people wear their shirts out. So, you know, it's kind of a covered area.
Mhm.
And so it really does not, from my own experience of doing many stature lengthenings and 8 centimeter lengthenings in the femur, it
Mhm.
really does not create a disproportion, a visible disproportion by doing that.
Okay.
And so that's one of the reasons I like the femur better. In
Right.
contrast, the tibia is very visible.
Mhm.
You know, your tibia bones, if you wear shorts,
Right.
or even if you're wearing pants, you know, the distance between your knee and your foot is much more visible. And
Mhm.
once you start doing big lengthenings in the leg and the tibia, it can look aesthetically noticeable.
Right.
And so that's my reason for wanting to do the femurs first. Furthermore, there's also some research that's been done that shows that if you have to have a disproportionality,
Right.
the disproportionality with favoring an increased length in the femur relative to the tibia
Mhm.
is actually healthier and safer and less associated with any problems such as arthritis in the hip or knee than the other way around.
Wow. I didn't
So
know.
those are the two reasons. There are many reasons I really do push people and or direct or encourage people to go in the with the path of doing femur lengthenings as an initial strategy.
That is
Now you
amazing.
asked about the arms.
Yes.
So you know, the arm, a normal arm length. If you stand up and you'll see that your arm sort of goes, your hands go to about your pocket level.
Mhm.
Okay. It's a little bit below the trochanters of your femur, sort of
Mhm.
that prominent part of your femur.
Right.
That's kind of a normal proportion,
Okay.
okay? The arms are really looked at and viewed aesthetically relative to the trunk,
I see.
okay? So
Yeah.
people who have short arms,
Yeah.
like let's say achondroplastic dwarf
Mhm.
patients, if you have a short arm, you will see their arms are short relative to their torsos,
Mhm.
and they can't get their hands past their waist. But for a normal proportioned adult patient,
Mhm.
the arm length is really not affected by stature lengthening.
Okay.
The leg length increases, but your arms are still able to get where they need to, which is to your pockets, below your waist for perineal care,
Mhm.
and aesthetically, they really do not need to be lengthened. So while I have done arm lengthening,
Mhm.
bilateral arm lengthening, I've done lots of arm lengthening.
Right.
Most of the time it's for arm length discrepancies related to particular conditions like
Mhm.
growth arrests or tumors and stuff like that.
Right.
I have done bilateral arm lengthening in the
Okay.
humerus because there are certain conditions that lead people to have short arms.
Mhm.
But when it comes to stature lengthening, it's really not typically needed, and we do not do that.
Okay, gotcha. That's clear, and I needed to make that because I get a lot of questions from that. So that's awesome that you made that point. Okay. What? Okay, so let's go back to leg lengthening. What? Every surgery carries a risk with it. Which complications have you seen, if any, and how likely are they to occur with leg lengthening?
Yeah, so you're asking a great question and a very important question.
Mhm.
And you're getting into an area that, you know, all surgeons and all patients need to really be aware about, and that's called informed consent.
Mhm.
You know, whenever you do a treatment for somebody, they have to be aware of what can happen.
Okay.
So I'm going to list sort of the typical or the most commonly concerning things,
Mhm.
and tell you about each one. So
Okay.
infection is a risk with any surgery,
Right.
but the risk of infection is really, really low.
Okay.
Really low. I've actually never had an infection in a stature lengthening
Wow.
patient. It's really low.
Mhm.
Our infection rate at HSS is about 1 in 300 cases.
Jeez.
And so if it happens, it can happen with any surgery, and we can deal with it, but it's a very low risk. Second thing is nerve injury. You know, you're doing lengthening,
Mhm.
and you are stretching the leg. Do the nerves get injured from this?
Right.
While it is a risk, again, the relative risk is very, very low.
Okay.
We will see, we do not see situations where people become paralyzed or lose any permanent nerve function.
Okay.
We do not see that. It's very unusual.
Great.
What we do see is temporarily people get sometimes they'll get little patches of tingling or numbness in their thigh or in their calf,
Mm-hmm.
which is some stretching of the sensory nerves called the saphenous nerve.
Mm-hmm.
And it resolves. That typically resolves, and it's really a non-issue.
Okay.
So that's really the second complication.
Mm-hmm.
Third complication is, like, again, when you do any kind of lower extremity surgery, there's always a concern about blood clots.
Mm-hmm.
Well, the risk of blood clot for patients when they take a simple prophylactic medication like an aspirin 2 times a day is extremely low.
Okay.
So it's really not a problem. It's it's a rare complication by taking a prophylactic medication.
Gotcha.
The other important part of preventing blood clots is just mobilizing, you know, and it's important that people understand after a surgery like this, they're not lying in bed. They are getting up and they are walking several times a day right from the get-go. And I think, you know, at some point you probably should ask me about, you know, the internal lengthening nails and sort of the differences between, you know, the titanium nails and the new stainless steel nails, because that's been a game changer in terms of our ability to mobilize patients more quickly, and that keeps people safe.
Yeah. Okay.
Another problem that we see that's not a serious problem is temporary stiffness. Okay. So everybody gets a little stiff temporarily. When you lengthen the femur, the knee gets a little stiff, the hip gets a little stiff. Physiotherapy is really important to prevent that from becoming a significant problem. But these are usually temporary problems, much better than when we used to use external fixators in the old days. And again, I cannot think of a patient who has ended up with permanent stiffness.
Gotcha.
I would say that the biggest problem or the biggest concern is quality of bone that is growing.
Okay.
You know, we'll see a difference in the bone quality when we do a lengthening on an 18 or 19-year-old compared to a 30-year-old, compared to a 50-year-old, compared to a 60-year-old.
Wow.
And as we get older, people's bone will not grow as quickly.
Right.
So the way we deal with that is usually the older individuals will lengthen a little bit slower. And so there are some tricks. But having said that, it's very important that we monitor patients very carefully, make sure that the elongation that's occurring isn't just creating a hole, and that there's actually bone growing in there and adjusting and making accommodations for that. And so there are, I would say in my experience, you know, probably 80% of patients have absolutely no problem growing bone, and it works out great. But then about 20% have to be managed a little bit. Sometimes we have to slow it down. Sometimes we have to do other treatments to encourage the bone to step up, like injection of bone marrow. And then even in a small group of patients who really are not growing bone well, we may have to go back to the operating room and do what's called an exchange nailing. So I would say that's probably the most significant complication that we keep an eye out for.
Okay.
And it's important that we identify it if it's a problem, so that we can take care of it and make it a non-problem.
I see. Wow. Really, really, really thorough. And I love that because, like you said, you take care of those problems before they get bad, because a lot of concerns that I hear people have is long-term problems. With any of your patients, have you heard of any long-term problems, or do you just address them right when they, you nip them right in the bud and they don't really rear their heads? Well,
I think you can avoid long-term problems by doing a good job from the beginning.
Okay.
I think, this is not a simple surgery. It requires experience. And I think that, in our business, we call them obstacles. Obstacles are, it's kind of like, what's an obstacle? An obstacle is a complication that you prevent from becoming a real complication by taking care of it. So if you're driving on the highway and you have a flat tire, well, that's an obstacle, right? If you know how to deal with that, and you get out of your car and you safely change your tire, you put your new tire on, and then you get back on your way and you make it to your destination. And all it was an obstacle. You got there a half an hour later, but you made it to where you needed to go.
Gotcha.
So that's what we strive to do, is if there are bumps in the road, if there are challenges, obstacles, we nip them in the bud. We know
Okay.
how to deal with these things
Right.
because we have experience.
Mhm.
We are limb lengthening surgeons who are not only just bone lengtheners, but people who deal with complicated situations.
Right.
I mean, we deal with deformities and non-unions and all these complex conditions that are sent to us for other reasons.
Mhm.
So if we see something happening, we have to nip it in the bud and prevent it from becoming a real problem.
Yes.
Now, having said that, I would say that in my group of patients, we have not seen long-term complications.
Excellent.
Patients, at the end of the day, patients always end up healing.
Mhm.
Patients always end up being symmetrical. We don't end up with dislocated joints or contractures of joints because we don't let that happen. And we deal with it as if there's any indication that something's going on, we deal with it to prevent it from becoming a complication.
That's what I
So listen, over the years, I have certainly taken care of patients who have had stature lengthening surgery elsewhere,
Mhm.
particularly some people who have gone overseas, gone to various places. And, I'm not speaking ill about any particular place,
Mhm.
but there have been some people who have come back, with really poor jobs done and with problems.
Yeah.
And so we have had to fix those problems.
I see.
So the goal is to really prevent. You got to go to somebody who's got experience
Mhm.
and who knows what they're doing and who can take care of the bumps in the road. It's like
Amazing.
anything else in life.
Yeah. So it really comes down to experience, like you said, and you guys at the HSS are really doing a great job. In fact, HSS, we all know, is a go-to clinic for many professional athletes, and limb lengthening patients, everybody who really wants to come out of this procedure and get back to doing what they love. So I just want to kind of go through some quick fire recovery questions because I know you got to go soon. So when it comes to recovery, a question that always comes up because people are worried: will the new bone be as strong as the old bone? Do you think that the advancements in the lengthening technology, like the STRYDE Nail versus external fixators, does this add to better consolidation of the bone, or will the new bone be as strong as the old bone?
So the biggest improvement, since you've talked about the different technology, when I started doing this 20 years ago, we used external fixators.
Mm-hmm.
And you know what? It worked. And we got patients, we achieved our goals, and patients grew new bone. But it was laborious. It was harder, much harder for the patient. They had to wear the fixators for a long period of time.
Mm-hmm.
And they had more difficulties, more pain, more stiffness of the adjacent joints.
Mm-hmm.
It really, the internal lengthening nails have been a game changer. And the first generation of internal lengthening nails really had problems with rate control,
Mm-hmm.
and really the ability to make sure that you were doing what you wanted to be doing, right? I mean, driving a car on the highway is only as good as being able to control your speed. You need to be able to speed up. You need to be able to slow down. You need to be able to stop when you want to stop. Nobody wants to be in a car that's a runaway car. So some of the early generations of the internal lengthening nails didn't have great control.
I see.
The magnetic internal lengthening nail that
Mm-hmm.
we started using in 2011,
Mm-hmm.
made by NuVasive, the precise nail, totally changed everything. It is a fantastic nail.
Mm-hmm.
We published a paper very quickly after we had done this for our first 25 patients, where we showed that the precision, the accuracy of the nail was actually 96%. It was fantastic. It was better than what we were seeing with the external fixators.
Uh-huh.
And it was a game changer. It allowed us to do it for patients more easily,
Mm-hmm.
in a controlled way, with less pain for them.
Mm-hmm.
And the bone formation was great. They were making great bone.
Mm-hmm.
And to answer your question,
Yeah.
the bone starts out being soft,
Right.
but eventually it consolidates and it becomes harder and harder. So when you're done, it is normal bone. It's not fake bone. It doesn't wear out. You don't have to worry about it. I mean, once it's healed, it's healed. I actually just did a telehealth visit before I started my interview with you with a patient of mine, Dan,
Mm-hmm.
who was just having some knee pain, and I had done surgery for him 7 years earlier for a leg length discrepancy.
Mm-hmm.
And we were both admiring the beautiful bone that you couldn't even see. You couldn't even tell what was the lengthened bone and what was the original bone, because it's not fake bone. It's 100% normal bone. The body has the ability to regenerate bone, and so to answer your question, it's just as strong eventually, but it takes time to get to that point.
Absolutely.
We usually take the rods out about a year later, and by that point, the bones are as strong as normal bone. Now, the STRYDE Nail, which was really just another generation that's been around really just for about a year now, and that is a stronger weight-bearing nail. Same type of mechanism of the magnetic internal lengthening. But the big advantage of that is that it's weight-bearing, and so it has allowed us to get patients up walking immediately, and really has eliminated the wheelchair from the treatment entirely. Wow. Now, that's a big advance, both psychologically, but also from a health point of view, because it gets people upright, it helps prevent contractures, and it gets them loading the bone more naturally, more physiologically, right from the get-go. But to answer your question, the bone eventually is strong as normal bone.
Gotcha. Okay. And that's what is most important, because a lot of people are worried, oh, it's not real bone. Okay. And like you said, the STRYDE Nail helps people get up and walking immediately. So when do you see like a normal walking gait for most of your patients to get?
Everybody's a little different. I usually, if we're doing, let's say, an 8 centimeter lengthening, it usually takes about 3.5 months to get the length. And patients are usually walking pretty well by around 5 months, but with a bit of a waddle. I've had some patients walking pretty normally by 6 months without assistance.
Right.
And for some people, it takes a little bit longer. So I would say the answer to that is probably somewhere in the 6 to 9 month range until people are walking without any noticeable limp. But we are getting people up walking right from the get-go. And a lot of the ability to walk without a limp has to do with hip muscle strength. And so it gets back to physiotherapy and the making sure that you stretch and you strengthen. That's a big important part of the recovery here.
Right. On a scale of 1 to 10, what would you say? How important would you say physiotherapy is for this whole process?
On a scale of 1 to 10?
Yeah.
11.
I love it. I agree. I completely
so
agree.
11 is really, physiotherapy is really important. I mean, surgery is, it all starts with the surgery. That's the foundation of what we're doing. And the post-operative care, making sure we get x-rays and visiting the surgeon is really important throughout this process. But the exercise to stretch the muscles and to strengthen the muscles is key, really key. And there are certain patterns. I mean, there are certain muscles that get tight when you do a femur lengthening, right? And there are certain muscles that get tight when you do a tibia lengthening. So it's not complicated therapy, but it has to be done on a regular basis. It's very, very important to do that to optimize the result and to hasten the recovery.
I see. Okay. So just a few more, like 2 more questions here, because I know you got to go. What about getting back to athletics? Because a lot of, like you said, the typical patient is usually a younger guy who's trying to improve his quality of life. They're typically active. They like to run, work out, stuff like that. When do you usually let your patients to resume their
workout? I mean, I think things like getting back to the gym and starting to do some lifting. People are doing that probably in the 4 to 6 month range. After the surgery. Very cool. I think when you talk about running, like really pounding the pavement, that's probably going to be more in the 7 to 9 month range. And it has to do a lot with making sure the bone is really well healed, and also that the muscles and the muscle strength and the muscle flexibility is present, because you don't want to get a secondary injury.
Right. Okay. So this is a really important question. If a patient comes to you from out of the country to do limb lengthening with you, and they want to, do you prefer that they stay locally, and do their physiotherapy at the HSS, or do you have options that they could travel home and you just kind of stay in virtual contact with an ortho and therapy team there? What's your thoughts on that?
So I will tell you, Victor, that probably about 2/3 of my patients are not local.
Okay.
And so we have a lot of experience making accommodations for people who come from out of town.
Gotcha.
Now, I've taken a philosophy of not requiring people to stay in New York.
Okay.
Now, if somebody wants to stay in New York, I certainly am happy to set them up. We've got tons of places where people can rent apartments or stay in extended stay hotels that are not too far from my office in the hospital, and we can set them up with local physiotherapy. And some patients choose to do that.
Okay.
But there are other patients who choose to go home, and that's okay too. I think the key to success is regular follow-up.
Right.
The regular follow-up can be done with a combination of in-person visits and virtual visits.
Okay.
X-rays need to be done about every 3 weeks,
Okay.
which again can be done in person, or they can be done locally and uploaded onto our server so that at a virtual visit, we can go over the X-ray. We have found that you can do a lot with a virtual visit. You can examine a patient, look at their range of motion, look at the quality of the bone, look at the X-ray with the patient by sharing the screen. You know, all the stuff that we are, you know, we're learning with in advances in technology. So, I mean, the key principles are X-rays need to be done every 3 weeks.
Okay.
Visits have to be done every 3 weeks. Okay.
Yeah.
And physiotherapy needs to be done several times a day.
I see.
Now, does it have to be in person? Does it have does every visit need to be with me in person? No, we can do some virtual visits.
Right.
Does every physical therapy session need to be done with a physical therapist? No. A lot, you can do a lot by learning the exercises and doing them on your own. So the key to success here is a motivated patient who's smart, who is diligent, and who's very dedicated to improving their outcome. But we make it work, you know, and we tend to be flexible and work with people. And there isn't an absolute that I require from every single person.
I gotcha.
What you can't do is just have the surgery and then disappear for 6 months and expect to have a good outcome.
Right.
I mean, we're very hands-on, and we're constantly interacting with our patients by email, with pictures, by these telehealth visits, and in-person visits.
Very thorough. I like that. And lastly, overall, do you feel like your patients who come to you for stature lengthening are content and happy with their new height and outcome?
So I think, you know, there's an old saying in surgery, and that is that you're going to get your best results by having good patient selection. And so I'm pretty thorough about meeting my patients in advance and deciding who I think is a good candidate for the procedure. Having said that, my experience has been extremely positive, and we've had really great outcomes. And you know, remember, we started this conversation by saying that the motivation for doing this was a psychological displeasure with their stature and how they felt. And so we've actually studied this, and we just published this article in the Journal of Limb Lengthening and Reconstruction. And that is, we looked at a group of our stature lengthening patients, and we administered to them validated psychology scores, a score called the SIBID score and the Beakley score. They are both validated psychology scores, and we were able to demonstrate that our patients had a significant increase in their psychological state, their happiness, body image, self-esteem after doing this surgery. And that confirmed for me what I have known just from, you know, talking to my patients and experiencing this with them, is that this does make a significant difference for the right patient.
I see. Wow. Well, I can personally say, Dr. Rozbruch, that, you know, people highly respect you and your work. I've been in the limb lengthening communities all about, and you're like a living legend to them. I mean, you know, and I know that after this, a lot of people are going to want to reach out. So where's the best place people can reach out for you if they have questions or want to set up a consultation with you?
Sure. You know, we have additional information on our website. You know, our website is limblengthening.com, and also through the hospital, hss.edu/limb lengthening. I have a stature lengthening site that is that we have that's dedicated to this topic, which is called staturelengthening.net. And all my contact information is on there. My email is on there, so people can reach out directly by email. But the bottom line is, you know, we're going to have to set up a consultation. All of the general information is available on staturelengthening.net. if somebody's local or can make a trip in person, that's going to be the best and most valuable way to go about this process, with an in-person visit, examination, and x-rays. If somebody's from out of town, the other thing that we can offer them would be a telemedicine visit or an informational video chat, and we have that as an option as well. They just have to reach out to my office and we can set that up for them as an initial point of contact.
Very cool. And I'll be sure to post all your website links and show in the show notes. All right. Well, if you have any following words, otherwise, if you want to say.
Well, Victor, I want to thank you.
Oh, really?
Because I think what you're doing is really wonderful. You know, patients get a lot of confidence from hearing from other patients, and so for somebody like yourself, who has been through the process, who is willing to share their experience with other people, I think is really fantastic. So I applaud what you are doing. That's why I was happy to do this video with you.
Wow.
And I would just finally say that, you know, when you as a patient are trying to figure out where to go, make sure your surgeon has experience. You know, there's no surgery is a craft. It's technical. You got to know what you're doing, and you have to have done a certain number of surgeries. You have to have a certain number of years of experience to take care of the particular problem. And then I think the other important thing, and I'm proud of, is that we really treat people like people. You know, I really enjoy the relationships that I develop with my patients. I get to know them. I like communicating with my patients. And, you know, when they're having difficulty, I want to hear about it so that I can help fix it. And so we're very hands-on, and I think that's really important.
That is it. That is amazing. Great way to wrap it up. Everybody, that is Dr. Robert Rozbruch of the Hospital for Special Surgery in New York City in the United States. I'll be sure to post all his contact information in the show notes. So if you want to reach out to him, you can do that there. Dr. Rozbruch, it was truly an honor. Thank you so much for your time.
Thanks, Victor. It was my pleasure.
I hope you enjoyed that interview with Dr. Rozbruch. He's very experienced and a true legend in the field of limb lengthening and complex reconstruction. If you're interested in reaching out to Dr. Rozbruch and his team at HSS, you can find the details to his contact information in the show notes. Until next time, this is Victor from Cyborg for Life, signing out.